You already understand what anesthesia is. Now let me show you what it actually feels like. In my previous video, I explained what anesthesia is and how it works. But one question patients still ask me all the time is this: what does it actually feel like when I go under anesthesia? So in this video, I'm going to walk you through the experience step by step, from the moment you're in the operating room to when you wake up, so you know exactly what to expect. Now let's talk about what it actually feels like. By the time anesthesia is given, you'll already be in the operating room. At this point, you'll be lying on the operating table. Monitors will be attached to check your heart rate, blood pressure, and oxygen levels. Your IV line will already be in place. The team will be speaking to you calmly, explaining what's happening. This environment is controlled and focused on your safety. When the anesthesia medication is given through your IV, most patients notice a few sensations quite quickly. You may feel a sense of relaxation, warmth spreading through your body, slightly light or heavy at the same time. Some people describe it as feeling like they are drifting or floating. This is the part many people are most curious about. For most patients, going under anesthesia feels like falling asleep, but much faster. And then, suddenly, you're asleep. There is no long transition. It happens quickly, and this is important to understand. You will not feel the surgery. You will not be aware of time passing. From your perspective, it often feels like no time has passed at all. One moment you're falling asleep, the next moment, you're waking up. When the surgery is finished, you'll wake up in the recovery area. Most patients describe waking up as feeling drowsy, slightly confused at first, sometimes cold or emotional. You may not immediately remember everything, and that's normal. Nurses will be right there monitoring you and helping you feel comfortable. A lot of patients worry about things like, what if I wake up during surgery? What if I don't wake up? These fears are very common. But anesthesia is carefully monitored by a dedicated team whose role is to keep you safe and comfortable throughout the procedure. As a perioperative nurse, I've cared for many patients going through this process. And one thing I hear again and again is, it happened so fast, it wasn't as bad as I expected. That's often the reality. Once patients understand what's going to happen, a lot of anxiety comes from not knowing what to expect. But once you understand the process, it becomes much less frightening. Anesthesia is designed to keep you comfortable, safe, and unaware during your procedure. If this video helped you feel more at ease, consider subscribing for more simple, practical guidance on surgery preparation and recovery. You don't have to go into surgery feeling unsure.